Issues: whether the self-service system of trading device by the defendant takes place when the customers put the items in the basket or at the cash desk, and whether the sales instant on 13 April 1951 were effected by and under the supervision of a registered pharmacist. Whether there is an invitation to the customer depends on the legal implications, and whether the supervision can be exercised when the contract is completed.
The introduction. Defendant is the Mass Boots Cash Chemist Southern Limited against the Plaintiff Pharmaceutical Society of Great Britain, who has filed for the breach of Section 18 subsection 1 of the Pharmacy and Poisons Act 1933. The main problem is when the claimant claimed that there was an act of selling poison without the pharmacist supervising the claimant. It was highly argued if offer is made when the items displayed on the shelves, inserted in the basket, or the time when the customer comes to the exit with the item they have chosen. The judges also said it was the duty of the plaintiff in taking reasonable steps to ensure there was the implementation of the act.
Facts of the case. It all started when Boots Cash Chemists renovated their branch pharmacies. They also have adopted the new self-service system where the drugs were placed on the shelf. There is one section of the shelf where the drugs containing poisonous substance are located there. Each customer who comes will be provided with a basket and allowed to select the medicine. Customer will pass by the exit where the cashier is stationed, and every transaction takes place at the cashier supervised by the pharmacist. On April 13, 2 customers visited the pharmacist and took the drugs containing the substance listed in the poisonous list and walked away to pay. A representative from the Pharmaceutical Society of Great Britain at the time witnessed the transaction and decided to bring the case to the court.
In the first hearing, Pharmaceutical Society challenged the legality of the pharmacist's self-service system for the substances that listed in poisons list. They further argued that every sales of drugs should be supervised by a pharmacist according to the Act. They even proclaimed that there were no steps taken by the pharmacist to inform the customers before they select any drugs to purchase. However, the court held that there was no infringement of the section occurred. This is because the supervision of pharmacists was present, although they do not directly involve with the transaction. The pharmacy station was situated near the poison section, and they are still able to oversee and supervise. Besides, the drugs purchased contains a very small proportion of poisons, which is allowed to obtain without causing harm. Hence, Pharmaceutical Society requested for appeal. During the second hearing, they had argued that the self-service system is constituted to an offer. This is because the drug display is an offer and customers accepted the offer when the item is being put in the basket. Furthermore, if the customer is having a tour of the premises while carrying the drugs, the contract is concluded. Thus, pharmacist has no rights to disallow customer to continue purchasing the drugs. Accordingly, the self-service system has violated the provisions of the Act.
Decision of the case. The Court of Appeal held that the defendant was not liable to the charge and no breach of act happened in this case. This is because the court held that the contract was not valid as the goods in the pharmacy was not considered as the offer. In this case, the displayed goods on the shelves as well as the price mark were considered as an invitation to trade, which was to attract people to buy it. The offer will be made by the buyer and the pharmacist will advise on the goods taken by them into the basket from the shelves before proceed to the cashier. As a conclusion, that is why the court held that there is no such contract made in the process and decided that displayed goods on shelves was not an offer but it is an invitation to trade.
Commentary. In conclusion, it is very clear in this case that contract and invitation to trade are similar but different in nature. We as a group agree with the decision of the judge because the good placed on the shelf are just an invitation and not an offer. It is the buyer that is making the offer and the seller is accepting the offer. In the case of Harris versus Nickerson, the defendant has placed an advertisement regarding office furniture and then it is placed for an auction and plaintiff spent a lot of time and money to travel from where he was. But the auction did not continue and plaintiff sued the defendant for the loss incurred. It is held that the advertisement itself is not an offer but an invitation to trade. We share the same opinion with the judge, where the pharmacist can only supervise if customer asks regarding the drugs. Without asking, they will not know in the first place what is the use of the particular drugs. Regarding the supervision of the drugs that are kept on the shelf, it only has a small amount of drugs that can be poisonous, so it is not poisonous if the customer take it with caution. If the customer is really afraid of buying the drugs, they are the one who is supposed to ask the pharmacist instead of waiting for the pharmacist to supervise them.